When a patient experiences mild respiratory distress, we need a solution that balances oxygen delivery with patient comfort. The nasal cannula is our first-line choice for stable patients who require low-flow oxygen therapy. It is uniquely designed to allow the patient to eat, drink, and speak without any interruption to their oxygen supply. This makes it the most well-tolerated device for long-term use in clinical settings.
The device delivers oxygen concentrations ranging from 24 to 44% by utilizing the nasal passages as a reservoir. It functions best at flow rates between 1 and 6 liters per minute to ensure proper titration. However, because the air is delivered directly into the nares, high flow rates can quickly lead to dry, irritated nasal mucosa. Understanding these flow limitations is critical for preventing patient discomfort and nosebleeds.
Effective nursing care involves frequent skin assessments behind the ears and under the nose where tubing causes pressure. To improve comfort, you must add humidification for any flow rate set at 4 liters per minute or higher. Always monitor the patient's pulse oximetry and respiratory rate to ensure the oxygen flow meets their physiological needs. Proper positioning of the prongs ensures the patient receives the full benefit of the prescribed therapy.